Could we hear from Dr. David Nathan?
Thank you. Honorable Chairman Keeble, members of the House Judiciary Committee. As a psychiatrist who treats patients with substance use disorders, and as the father of 2 teenage children, I'm here to offer my strong support for H. 5555 in the state of Rhode Island. Originally from the Philadelphia area, I graduated magna cum laude in biology from Princeton University. I received my MD from the University of Pennsylvania School of Medicine and completed my residency at the McLean Hospital of Harvard Medical School. In my final year at McLean, I served as chief resident of bipolar and psychotic disorders. My wife, Karen, grew up in Pawtucket, and her parents lived here until recently. So my growing family has spent many happy times in the Ocean State. Our children, Eli and Sophie, are fans of Caserta's Pizza, Dell's Lemonade, and of course, the Paw Sox. While not a Rhode Island resident, I'm a clinical psychiatrist with experience in substance abuse, and I'm well versed in new approaches to marijuana policy across the country. I'm also the director of continuing medical education for the Princeton healthcare system, and I'm board certified in psychiatry by the American Board of Psychiatry and Neurology, clinical associate professor at Rutgers Robert Wood Johnson Medical School, and a distinguished fellow of the American Psychiatric Association. I volunteer as the physician advisor for the New Jersey State Chapter of the Depression Bipolar Support Alliance. I've published numerous articles in the national psychiatric and lay press about a variety of topics, one of which is the legal status of marijuana. In my role as a general adult psychiatrist, I have seen too many lives ruined by marijuana, not by the drug itself, but by a legal system that chooses a sledgehammer to kill a weed. The racial disparities in the enforcement of marijuana prohibition are beyond dispute. This has harmed communities of color, perpetuating the cycle of poverty. Poverty leads to reduced access to health care, and that makes prohibition a public health disaster as well as a social justice atrocity. This is why, as a physician and as the father of 2 adolescent children, my conscience compels me to submit this testimony in favor of the full legalization of marijuana in New Jersey. This is also why, in 2015, I founded Doctors for Cannabis Regulation, or DFCR, the first and only national physicians association dedicated to the legalization, regulation, and taxation of marijuana in the United States. I'm proud to serve as the board president of DFCR, an organization that strives to neither minimize nor exaggerate the health benefits and risks of marijuana use. In my testimony today, I'd like to anticipate several of the questions that most commonly come up among legislators about marijuana legalization. After that, I'd be happy to provide more detail about any of these topics and address any questions. So the first question is, why would physicians or legislators support the legalization of a potentially harmful substance? Most adults who use cannabis occasionally are not harmed by it. Marijuana is unsafe for underage users in recreational use and a small minority of adult users. But alcohol and tobacco both pose a far greater public health threat. America learned a lot from the failed experiment of alcohol prohibition in the 1930s. While alcohol and alcoholism did decrease from this draconian policy, the societal problems created by it were so great that many prohibition advocates changed their minds and supported its repeal. I'm not the only physician who feels this way. A 2014 WebMD Medscape poll indicates that most American physicians believe that medical marijuana should be fully legal, and hundreds of thousands of doctors now support general legalization of cannabis for consenting adults. Just as public support for legalization has been growing for the past 40 years, more and more doctors are realizing that you don't have to be pro-marijuana to oppose its prohibitions. Physicians know that government regulation and public education have been instrumental in reducing tobacco use in America. Yet after 79 years of marijuana prohibition, this drug is as popular as ever. In short, the war on marijuana has failed, and it's time for change. Why should we legalize marijuana when we already struggle with alcohol and tobacco? It often comes up. Some would say that we shouldn't make yet another drug legal, but the harm that any drug causes, if it is less than the harm that we accept from legal drugs, then it defies logic to prosecute consenting adults from using the less harmful drug. Nonetheless, we do have a responsibility to regulate and educate the public about all potentially unhealthy activities, and we must do so with marijuana from the outset. Even experts who oppose cannabis legalization concede that it is less dangerous than other legal drugs. Some of these same opponents would make alcohol illegal if they could, despite the miserable failure that alcohol prohibition proved to be in the 1920s. By the time that social experiment was finally halted in 1933, the people who tried to get prohibition passed were supporting its repeal. And is legalization for adults going to increase underage use of marijuana? Will kids have more access to the drugs? The initial data from Colorado and Washington suggests that there has not been a dramatic increase in use. And while we cannot predict the future, there are good reasons to believe that legalization may actually decrease underage use, and there is a trend in some of the legal states showing that this is now occurring. First, government-regulated retailers check ID, and they only sell cannabis to adults, while illegal dealers sell marijuana to kids. Thus, minors will have fewer points of access to the drug under a regulated system. Second, if marijuana is legal for adults, then the police and courts will be able to focus their attention on enforcement of laws against the diversion of marijuana to minors. Sadly, marijuana prohibition has failed in this most basic intent. For decades, the government's own statistics show that 80 to 90% of 18-year-olds report that marijuana is very easy or fairly easy to obtain if they want it. And I'll tell you that my 16-year-old son has told me that he could much easier get marijuana in his school than he could get alcohol. And while underage use of alcohol and tobacco, both drugs that have always been legal for adults, except for the brief time of prohibition, the underage use of those drugs has fallen in recent decades, yet the use of marijuana has increased during its prohibition. The regulation of the cannabis trade, coupled with smart and realistic youth education, may help decrease the underage use of marijuana. Many ask, will marijuana lead to the use of more dangerous drugs? The gateway hypothesis. We all grew up learning that marijuana was a gateway to harder drugs. We all grew up as drug warriors. This is still a claim repeated over and over again without evidence by those opposed to changing our marijuana laws. The reality is that the gateway theory is not supported by research or evidence. A study by the Institute of Medicine, the health branch of the National Academy of Sciences, concluded that marijuana does not appear to be a gateway drug to the extent that it is a cause or even that it is the most significant predictor of serious drug abuse. Alcohol is a much better predictor of hard drug use. While it's true that the users of hard drugs often do try marijuana first because it's widely available, they also are much more likely to have tried alcohol and tobacco and Coca-Cola and, at some point in their remote past, milk. And yet, the vast majority of those who try marijuana don't go on to use harder drugs. Simply put, the fact that the teenage use of marijuana is associated with the later use of hard drugs does not mean that marijuana causes people to use hard drugs. It is a misleading and it is an oversimplified explanation of what leads to substance abuse, and it does a disservice to the discussion of this important public health issue. In the same way, the New England Journal of Medicine published an article showing that countries with greater chocolate consumption also have a higher number of Nobel Prize winners, published in the New England Journal. But, as much as I love chocolate, no one really believes that chocolate turns people into geniuses. Another question is, does the legalization of marijuana for adults send the wrong message to our children? It's quite the contrary. When cannabis is against the law for everybody, the government is saying that marijuana is dangerous for everyone, And kids know that that's not true. If we adults can't be trusted to tell the truth about responsible adult use of marijuana, why should kids take us seriously when we tell them it's harmful for them? By creating a legal distinction between marijuana use by adults and minors, we demonstrate a respect for scientific evidence that we would want our children to emulate, and it also, as a side benefit, shows respect for the law. Whether in sexual health education or drug education, when kids know that we are being honest with them and trust the information we're providing, they are more likely to take that advice seriously. And we know that preventive education works. As I said, the rate of underage tobacco use and alcohol use have been falling for decades, even though it remains legal for adults. Marijuana use in kids has gone up in over those same decades, despite the fact that it was until recently illegal in all 50 states. Another question is whether marijuana is more potent than when we were young, and does that make it more dangerous? Cannabis cultivation has led to the development of more potent strains to the extent that illegal marijuana is today typically about 5 times stronger than it was 30 years ago. Where marijuana is regulated, products are labeled for potency, and adult users can make informed decisions about their intake based on potency, much as people do with alcohol, say, drinking a small amount of alcohol compared with 2 beers. But where it's illegal and uncontrolled, marijuana products aren't labeled, and users can inadvertently consume too much of a potent product. To me, this is another medically sound reason to legalize marijuana. If marijuana prohibition made sense in the past, what, if anything, has changed? And the answer is, simply put, nothing has changed. Marijuana prohibition began in the 1930s over the objections of the American Medical Association based on scare tactics, bad science, and implicit racism that suggested that the drug was highly addictive, made users violent, and was fatal in overdose. We now know that none of those assertions are true. Cannabis is less addictive than alcohol and tobacco and has a similar addiction rate to caffeine. It does not make users violent, and there are no documented cases of fatal cannabis overdose. In short, from the medical standpoint, marijuana should never have been illegal for consenting adults in the first place. So my last rhetorical question is, what kinds of regulations are central to optimizing public health outcomes of marijuana legalization? Doctors for Cannabis Regulation promotes a number of key goals of regulation. First, government oversight of cannabis production, testing, distribution, and sales. Second, detailed labeling of cannabis products, including the THC and CBD levels, dosing, and ingredients. Third, restrictions on marketing and advertising of cannabis products, including bans on targeting underage users and requirements for child-resistant packaging. And the next is penalties for adults who enable the diversion of cannabis to minors. Then the fifth is adult education about the use and misuse of cannabis. Sixth, preventive youth education about the harms of underage recreational cannabis use. The taxation of the cannabis trade to fund research, education, treatment, and community reinvestment. And finally, we stand for the diversity in all aspects of the cannabis industry, rebuilding the communities most affected by cannabis prohibition. I've addressed some of the major public health concerns about marijuana legalization, but I would be happy to answer any other questions you may have. I thank you for your time and the opportunity to speak about this timely issue.
Thank you, Doctor. Any questions? Representative Ella Wilkinson.
Thank you very much, Mr. Chairman. Sir, thank you very much for your testimony. Very informative, very comprehensive. Now, I have a couple of questions for you. You had drawn a parallel between the use of caffeine and the adult use or ingestion of marijuana. So
the only parallel that I was suggesting is in the addiction rate, which is about 9% in each case.
Okay, thank you for that correction. Could you please explain to me how long and the average adult, after having ingested marijuana either by smoke or in some type of an edible, how long does the effect stay with that individual, and typically what kind of effects are there?
Well, I can go through. Do you want me to go through the health effects of cannabis?
I'm not interested in the health effects. I'm more concerned about the short-term effect, because the law that you are promoting or that you are advocating for specifically says that the user cannot be ingesting marijuana while they're driving, or a passenger cannot ingest it in a vehicle.
Right. No.
And so my concern is how long typically would the effects last on an individual, and how would he or she understand that they were still experiencing those effects prior to them getting behind the wheel of a car?
Right. Good questions. So, several answers to that question. One is it depends on the mode of ingestion. So if you are ingesting it by inhalation, then the effects typically last about an hour and a half, maybe 2 hours. If it is through an edible, depending on the strength, it can be several hours. And so it is for that period of time when you would be experiencing, assuming that there's THC in the cannabis, you would be experiencing intoxication. Subjectively, people generally know if they're intoxicated. The subjective report of that tends to be pretty clear. As for the issue of drug driving writ large, we have to keep in perspective what the level of impairment by marijuana is. I'm not saying that there isn't any. There is. Particularly for naive users, in experienced users, there can be little or no impairment of driving in objective testing. But let's also put it in perspective. The amount of impairment from a typical ingestion of marijuana, which would be equivalent to, say, 2 drinks or a blood alcohol level of 0.05, that's a typical intoxication of marijuana in terms of its effect on driving. That is to say, when somebody has reached the limit of driving while intoxicated with alcohol, it's 0.08, and that means that their intoxication raised their risk of an accident 13-fold. With marijuana, that tends to peak out at around 2 to 3-fold. And so there's a great difference in the level of impairment. And actually the level of impairment, though I am certainly not recommending that we condone driving while intoxicated with marijuana, that level of impairment is similar to the level of impairment that you get from driving with a hands-free cell phone conversation. It's about 2 to 3-fold.
And I do understand, of course, if someone is driving under the influence of alcohol, how law enforcement is able to test them on the roadside. Mm-hmm. But what, if anything, could be done that would be comparable for someone who's driving under the influence of marijuana?
There is field testing, and to the degree to which the field testing itself is limited, it's because the impairment tends to be on the lower side, and so it doesn't tend to affect reflexes and balance and perception of moving objects in the same way that alcohol would. So field sobriety tests are very sensitive to alcohol intoxication, a little less so for marijuana intoxication, and that's because it tends to cause less impairment.
And that's under the assumption that the individual smoked a moderate amount or ingested a moderate amount of the edible. It's going to depend.
That's
I'm
correct.
assuming it depends upon the weight of the person, or whether or not, if it's an edible, whether or not they ate on an empty stomach or anything of that nature.
And how recently. If somebody has, and so to your point, I think I see where you're going with this, which is what about at the extreme? A naive user who is overconsumed. That person is not going to pass a field sobriety test. They're going to be clearly impaired, and I do believe the police are adequately trained to do field sobriety tests, and that would include for cannabis.
One last question, and I recognize that it's what your opinion is, and it's not based in any kind of fact. All right.
It depends.
So if marijuana is currently illegal, do you believe legalizing it would encourage more people to utilize the drug?
I think that the adult use would go up. I think that underage use would stay flat, and in the long run, it would start to go down. You're right. Nobody can predict the future. But at the same time, what we do see in the legalized states is an even trend or even slightly downward. There is one collection of evidence that contradicts this, and that is from the Rocky Mountain HIDA, high-intensity drug trafficking area data that they accumulate. When you hear that data, you should know that, just as I'm here giving my point of view that I think it should be legal, which is based on my view of the evidence, they are doing the same thing, except that the evidence that they're choosing very much seems to fit their description and is often at odds with what the states themselves are collecting in terms of evidence. So back to your point about drug driving, some would point to the fact that you're seeing a higher number of people test positive for cannabis, either in accidents or if they're pulled over and they're given a blood test. They will show that they have THC in their system. It doesn't necessarily indicate that that is intoxication, and it also is much a factor of adults using it more. So they will test positive, but that doesn't imply any impairment. And to show that there actually may not be the impairment, the rates of fatal accidents, and I'm not sure about accidents at large, but I think there's some trend with that as well, but fatal accidents continue to fall at the same rate in legalized states that they do around the country. They're falling everywhere, so it's not as though there's something particular to those states. But in the states where it's legalized, they continue to fall at the same rate, meaning that we do not seem to see any excess mortality as a result of the legalization of cannabis on the roadway.
And I'm sorry, I know I said that was the last question. The impact, if you know it, of either smoking marijuana, ingesting it, or being around secondhand smoke to a woman who's pregnant?
Yeah, see, that's really not well known. Some would say it's harmless. I would say that because there isn't the evidence, the absence of evidence doesn't mean the evidence of a problem.
Right.
I would never recommend that a pregnant woman use it for anything other than a very compelling medical reason. But I don't suggest the use of marijuana in pregnancy any more than I would suggest the use of alcohol. Your question is also about secondhand smoke. People who experience secondhand smoke do not get a significant dose of the drug unless they're sitting in a small car and they're doing the proverbial hotboxing. Then you can actually be ingesting enough marijuana to get a reaction. But if your kid tells you that they tested positive for marijuana because they were in a room with other people, you can call shenanigans on that one.
Thank you for your time today, sir.
Thank you.
Mr. Chairman, would you annotate me for the vote earlier?
Absolutely. Representative Ella Wilkinson would like her votes recorded, so ordered. Thank you, Doctor. Any further questions? No. Thank you, sir.
Oh, wait.
Oh, I'm sorry, Representative Almeida.
Thank you for your testimony. Just two questions. I want to put words in your mouth, so I apologize. Testing for police officers, who is your organization or any doctors offered any of this on-the-field testing?
The actual training?
Yeah, the training.
We have not personally done that. I don't know if other drug policy organizations have done that. It certainly should be done. It should be done in a way that provides realistic training on what the actual impairments would look like. And again, you really have to get somebody who is more of a naive user and uses quite a bit of it to actually measure impairment. And what that means is that if it's not creating impairment in any kind of physical test, then it's likely not creating impairment in driving itself. And so in an experienced user who consumes a moderate amount, there's generally no impairment of driving. And I'm a doctor saying that. I don't say these things callously. I don't encourage people to consume and then drive. But the fact is that the impairment is relatively small when compared, for example, to alcohol, again, a 13-fold increase in accidents versus a 2-fold increase.
Well, you're still, you have my mind going all over the place. I'm just concerned about a young police officer trying to do his or her job. Have you, I guess I'm giving to you as a suggestion. Why don't you all reach out to the police department and help them with the training? The chief that was up here earlier, unfortunately, he was stuck between the black hole of legality and what people want to happen. I truly understand that.
Yeah.
But I don't think that the police departments need to be stuck in a legal black hole.
Well, you made me think
so
of
the training should come from you all. So at least the officers got one more weapon to fight with. So
you jogged my memory, which is that law enforcement, they recently changed their name, Law Enforcement for Progress in Legal Policy, LEAP. It used to be Law Enforcement Against Prohibition. They've expanded their mission somewhat. They are our partners, and they are very much about training officers properly. And as far as the young officer goes, you know, a lot of the problem is that officers, when using their discretion, I'm not talking about driving now, I'm just talking about picking somebody up on the street. They will use their discretion as to whether to arrest somebody or just tell them to step on the joint and walk away, based on whether they look like they're making any trouble for anybody. And when you start using appearance of somebody as a way of distinguishing who the bad person is, then you're going to get into the racial bias that we see with that very well verified 4-to-1 ratio of arrests between African Americans and white Americans.
Well, trust me, I'm very aware of the war on drugs. To me, it was more a war on race, but as a subject for another day. Senator Kells or Chief Kells, a medical question. Does it affect the lungs as much as cigarettes, or what's the effect on the lungs?
Right, so that's complicated. So the best study that's been done has been done by UCLA on lung cancer, which is really the main question people ask about. And that showed no correlation between cannabis use and lung cancer. They did find, however, that people who use marijuana and tobacco have higher rates of lung cancer than people who use tobacco alone. So my recommendation is don't mix the two. I mean, obviously, people should be avoiding tobacco entirely. Don't mix the two. And there's also the question of other kinds of lung injury from smoking. Emphysema, chronic bronchitis. People smoke a lot less, they inhale a lot less smoke with marijuana. The smoke can be hotter depending how they're smoking it and whether they have a cooling system or not. And what I tell my patients, what I tell my friends and relatives is that my suggestion, my belief is that extremely hot free radicals with known carcinogens is probably not a great mode of ingestion, and I don't recommend smoking as a harm reduction measure. If you're going to use marijuana, you really should either be vaporizing it, or if you know what you're doing, ingest it as an edible. I actually think vaporizing is better because it's shorter acting, and you can more easily titrate or taper the amount you're consuming.
Well, Chief Kells brought up a good point, but if we're taking marijuana with tobacco, so the kids, what they'll do is they'll split open the cigar,
Right.
fill it in,
Right.
roll it up.
A Dutch.
Better known as a blunt. You call it a Dutch. Well, there's two different worlds here. But
Or a split.
but I'm still concerned about the police officer and the good points that the Chief Kells had made.
Yeah.
That now you really got me thinking here, because with the tobacco war on lungs, as the chief brought up, and how does the officer, how will that affect if the officer's trained to do a field test? Will that test show something greater or less because it's in a blunt?
So people are trying to find a good test for recent ingestion of cannabis, either inhaled or eaten. It hasn't happened yet. You'll see claims in the media about, you know, this new test was invented or that. It hasn't happened yet. People are working on it, but it's a problem that has not been solved as far as being able to truly measure whether somebody consumed recently. The points that Chief Palmer made, I thought, were excellent ones. I thought that the points he made were very persuasive ones in showing the scope of the problem. But as I see it, what he was describing were very strong arguments for good regulation of cannabis. What he was describing was not arguments for continuation of the drug war that has created most of the problems that he's describing. By legalizing, regulating, taxing, and sending those taxes to the right places for youth education and to prevention of diversion to minors, then you're going to see an improvement in public health, specifically as a result of marijuana legalization.
Sir, I thank you, but again, I'm just stuck on training for the officers, but I appreciate it. Thank you.
Thank you. Any further questions for this witness?